So look at this case note. The key here is to realize that the patient, everything is given in the note, of course. Date of admission is 12th June and date of discharge is 16th June. Here, we're talking about the diagnosis and everything. Key factor is the residence, you see. You should not ignore this. You should be very careful with this. The Somerset Nursing Home, right? That's the place where the patient lives, right? Annie Ellis lives here. When you go to the bottom of the letter, here, towards the end, you'll come to realize that the patient is also, the reader of the letter is also at the same nursing home where the patient resides. So you can consider this place like an old age home, or like in Nepal and India, we have Vriddhashram, home for old people. It's very popular in Western countries where people save a lot of money, and then when they get really old and where they cannot take care of themselves, they live in the nursing home. Not nursing home just, but in aged care homes. So remember the key, what I'm trying to say here is whenever you notice nursing home, whenever you notice aged care home, you have to realize that this is a discharge letter. So remember, we've talked that there are three kinds of letters that are asked in OET. The first one is referral, of course, the most common. The second is going to be discharge, and then the transfer. So this is a classic discharge letter because the reader who's going to receive your letter is from the same place where the patient resides. So note it down, girls. Whenever you see aged care homes, whenever you see nursing home, whenever you see that in the social history of the patient, the address or the place where the patient resides is similar to the one who is going to read the letter, then you should come to the conclusion that it is a discharge letter. Remember, sometimes at the bottom of the letter, here, like using the information in the case note, write a letter. Very rare that they tell you write a referral letter, write a discharge letter. Sometimes the OET, they don't clarify what kind of letter you have to write. So it is your judgment to know if this letter is a discharge or a referral letter. So two options you have for this. If you are unsure about the type of letter, go neutral. That means I'm writing in reference to, I'm writing with regards to. But if you're absolutely certain, then you can write, I'm writing this discharge letter, or I'm writing to update, because the patient comes from the same nursing home where the reader is the manager, Mr. Paul Ferris here, right? So maybe Mr. Paul Ferris is a medical professional, maybe a nurse, but let us categorize this as writing to somebody who is not a medical professional, not a nurse. So remember, we've talked about this earlier as well. We can categorize our letters into two parts. One is writing to healthcare professionals, nurses, and doctors, where you do not have to worry so much about the language because you yourself are nurses. Writing to non-medical professionals such as social workers, manager, right, directors. Then there's one that's between these two extremities will be allied healthcare professionals. That'll be occupational therapists and then physiotherapists. They're not exactly healthcare professionals, but they're assisting the healthcare professionals. So remember, there is a criteria in writing called genre and style. If you want to know about the criteria of writing, you can watch some videos. It's on my channel as well, and I can send it to you if you really want. But what I'm trying to tell you at this moment is that there's a criteria in OET writing that's called genre and style. That means the way you write should be in conjunction to the understanding of the reader. So if the reader is a non-medical professional, there's no point talking about medical details. But if you write to a nurse, if you write to a doctor, of course, you can talk about everything. That is the medical things. They are expected to understand what you try to write. So understand this. This is a key here. This is the So if you start your letter with I'm writing refer, basically, it's a game over. So 4 days of hospitalization, admission, discharge, right? So renal colic, dilation of left collecting system. Okay, PUJ calculus. Widow, we don't need to tell. We don't, next to kin, we don't need to tell. We don't need to tell retired teacher. We don't need to tell pensioner status. We don't need to talk about hobbies. We don't need to talk about the current affairs. We don't need to talk about amateur tennis player. We don't care about these things. It is like you telling my mother that I'm married. You get the logic, right? So I'm giving you an analogy. If you tell my mom, say, okay, Dr. Nishant is married, she's going to be surprised. Why are you telling me this? Because I was at the marriage by myself. If you tell that, oh, Dr. Nishant has a daughter, so that is again not a surprise for somebody who knows me. So here, the reader knows the patient. Therefore, any history that you give is useless in your letter. So that is going to be a content error. Content error means the information that you've chosen to be mentioned in your letter went downhill, right? So social background, no problem, no need to mention. Next to kin, no need to mention. We don't even have to say that the patient lives at a Summerseat nursing home because the reader knows. Widow, also we don't need to know. Just put date of birth as a formality and age. That's it. After that, medical history, we don't care. So about here, so 12th June history, when it starts, yes, you can mention that this is the way the patient presented. But the thing is, we have controlled the patient. So what is the basis of discharge? The patient gets discharged. Why do we discharge patients? We discharge patients when we are sure that the patient has healed, the patient has recuperated. That is the basis of discharge. So if we are discharging the patient after 4 days of hospitalization, that means the patient is stable, the patient has recovered. That is the basis of discharge, and we are asking for continuity of care. We are asking somebody to actually keep an eye on the patient in future. So instead of telling how the patient initially presented and how did we fix the patient, you better tell in the second paragraph what made you believe that the patient is ready for discharge, because that is going to be the main concern from the reader's point of view. So medication and treatment. So whatever medication you've given, yes, you can give a brief detail of whatever you had done, but you should not tell things in so much of detail. Like here, diclofenac, this IV things. We don't need to mention because when the patient is going to be discharged, the IVs are going to be removed. And maybe it is going to be converted into oral forms. So yes, those oral forms, that is going to be continued in the future, you can mention, but otherwise, we do not need to be very detailed about the medical interventions as well. So your assessment, so here, final assessment on the day of discharge, you see 16th June here, patient fit for discharge with analgesia, to continue temocillin and paracetamol. So here it is. You can write the dosage of these things because it is going to be continued in the future. Now, discharge plan, monitor medication, pain relief, increase fluid intake, monitor or urine output, use of sieve to check for the passage of stone for the future lab analysis. Then monitoring by diet to decrease salt intake, avoid excessive da da da. All of them can be included here. Now, the only medication that we can mention is temocillin and paracetamol because these are the things that we've introduced while the patient was hospitalized. Everything else doesn't need to be, don't need to be mentioned because we did IV, but IV has been removed as well. We do not need to talk in so much detail, especially when we know that the reader is a non-medical professional. So we should focus more on what is needed in the future. We should focus on what is the current status of the patient. We can give in brief how the patient's condition was in the beginning. What did we diagnose? Yes, you can put that, but don't go into serious detail in the letter. So considering all this, we're going to now start editing our letter. Very important letter. It's a past question as well. You need to master this. It's been a while. Nobody has asked a discharge letter. It's been 4 or 5 months here in Nepal and also in England. Uh, so get used to it. So Mr. Paul Ferris. So I have no complaints with the format of the reader. Date format is correct. Everything is fine, dear Mr. Ferris. Correct. I'm writing with regards to Mrs. Ellis, who is going to be discharged today and will be needing your continued, not needing your, will be needing your continuing care. Not continued care, continuous care. The better way is to write about the update. So let me tell you a story and try to listen to it carefully. The language in the way you express yourself is very, very important. So let's imagine, just look at this thing that I draw on the screen for you guys. Let's imagine this is the nursing home where Annie Ellis lives. It's ugly, but you understand. And this is our hospital. Super tall hospitals with all the facilities in the world. Yeah, it looks beautiful, isn't it? Then, so one day, that is 12th. What was the date of admission? 12th or 13th? Yeah, 12th. So on 12th, maybe the patient is sleeping in her bed and she started crying and saying that, oh, my blah, blah, blah hurts, my groin hurts, and my da 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 hurts. So Paul Ferris, let's imagine this is Paul Ferris's room. Immediately, somebody informs Mr. Paul Ferris. Paul Ferris immediately comes to see and says, oh, okay, the patient cannot be managed here. Let's send the patient to the hospital where the patient can be managed. So patient lives here for how many days? 4 days. And then what are we doing? And then we are actually sending the patient back to the same place where the patient belongs to. So this is a referral letter. That means imagine in the flashback, like in movies, there must be a referral letter first written to us, to which we responded with a treatment, and this is a discharge letter. So in the referral letter, all the details must have been already given, remember. You understand this dynamics, right? Referral letter and discharge letter. So, so basically what we are doing to the reader, we are updating the reader about what is going on with the patient because the patient the reader already knows. Or you can tell, maybe the reader doesn't know the diagnosis. He just knows that there was a groin pain, there was a presence of groin pain and intense pain that led to the hospitalization. So we can say that the patient was diagnosed further when he was hospitalized with this. Now has successfully received a treatment, successfully healed, and so we are discharging. So give the basis of discharge in your intro. So I'm writing with regards to Mrs. Ellis, who is going to be discharged today and will be needing your continuing care. But what happened to the patient? Remember, we've talked about this in the intro of the letter. It is always better. Actually, no matter what you write, it is fine. But you should actually have a habit of doing the writing in certain way. Because if you experiment too much, then in the exam you will be confused because you'll think that everything is significant. That's why keep the basics very simple. Two ingredients of intro. Number one, what do you want from the reader? And what is going on with the patient? The patient has recovered, the patient has received treatment. So, three things you should consider when you're writing a discharge letter in the intro. Number one is recovery status. Because recovery is the reason why the patient is discharged, isn't it? If there is no recovery, you will never discharge the patient. Then comes number two, when, and three, where. It is always important to mention when and where, however, are not very important, but recovery status is very important. So when and where means it's going to be discharged today. So you've mentioned today already that this qualifies as when. And where means going to be discharged, going back. We're discharging back the patient. If you put back, that already qualifies as where. Now, recovery status means what is the current standing of the patient who has successfully received the treatment, who has received treatment, or who has treated for, and give the diagnosis, right? So I have talked about this before. The relationship of the first paragraph with the second paragraph contributes to the purpose of the letter. Purpose is one of the criteria of OET letters. What is the meaning of purpose? I'll tell you simply, the relationship of the intro of the letter with the second paragraph, that is called purpose. You cannot mess that up in the exam. Because when you look at a case note, you will feel that everything can be written in the second paragraph, but it is not like that. So there are two ingredients I talked, isn't it? The two ingredients of introduction. Number one is what's going on with the patient? Patient And another second one is, what do you want from the reader? You want follow-up care. You've already given continuous care. What do you want from the reader? Right? So in the second paragraph, depending on the circumstance or circumstances, you either expand number one in the second paragraph or you expand number two in the second paragraph. But in the discharge letters, usually you always expand what is going on with the patient. That means what was the basis of discharge, what led to discharge is what you're going to mention. So you're not going to tell that the patient was admitted with this. You're going to tell the result. No matter how the patient was admitted, what is the current standing of the patient at the time of discharge? This is the information you put first in the second paragraph. Remember, some letters require expanding what you need. Remember, we did a letter last time seeking for a refuge for a patient. So in that one, you're telling why is the patient needing temporary accommodation. Why? Because she has nowhere to go. You're giving the reason. Social history was the proof. But in this one, recovery status is going to be the proof. So what made you believe the patient is fit for discharge? So let's see what you've done in the letter. So your letter's intro doesn't have any power. It doesn't have the necessary ingredient. Mrs. Ellis presented at this hospital with abrupt. Now, I don't know how to tell you guys this, but no teacher in the world can teach you how to spell things correctly. If you don't spell correctly in a language exam, yeah, then you're going downhill. So please be aware by yourself and please develop the style of proofreading. You have to proofread your letters well so that you avoid making spelling mistakes. So with abrupt onset of intense unilateral left loin and groin pain, don't you think the reader knows this? This is what happened that led to the referral. And then now we're discharging. On assessment, her blood pressure was this, pulse rate, there has to be space between pulse and rate was this. The CT results showed, but yes, this is important. Multiple renal calculi, moderate bilateral hydronephrosis, dilation of left collecting system. And yes, you can mention this, but this letter became completely medical. I mean, if you're writing to a nurse, if you're writing to a doctor, yes, it makes sense. This is what is going, this happened actually. Now, but what did you do in response to whatever has happened? So this is not a correct second paragraph for you. During hospitalization, this is also not a correct paragraph. This is the correct paragraph that should be put in the second, as a second paragraph, the proof of your intro. So currently the patient is on oral medication. And let's do one more thing, girls. From now on, we're not going to write the patient in our letter. We're either going to use he or she or the name itself. No patient name, just he, she. So currently, she is on oral medication with stable vital signs. Yes, these are the things that you need to know. You need to tell the reader. The reader needs to know. So reader must be thinking, okay, we sent the patient with intense pain. So tell me something new. What is something new? That the patient's vitals are stable. The patient is feeling better, right? So, so this is your actually second paragraph. So whatever you've given there, of course, can be summarized into one paragraph, can be squeezed into one paragraph, but just don't go in so much of details. Moreover, I've actually mentioned this in our earlier classes as well. Never write, never use moreover. In addition, furthermore, moreover, besides, suffering should not be included in any letters. Urine output should be monitored, and SIF should be used to check. So what? You've actually merged the current status of the patient with the discharge plan. You don't have a separate paragraph where you tell the discharge plan. So your letter is not organized properly. There is special paragraph which gives all the details about the discharge plan. Why not to write all the discharge plan into one paragraph? That's called organization of the letter. And organization of the letter, organization is one of the criteria of writing. So here, your information, the information that you've given in the paragraph, they're jumbled up into one and you've not organized the letter. So you need to segregate into separate paragraphs. So one paragraph, one content. So why to mix what you need in the future with during hospitalization? You can talk about, wait 1 second. Of course, you have to, Of course, upload your letter. Why do you need to ask me? Whoever has done their letters, please upload the letters. One second. Who left the class just now? Anyway, it doesn't matter. So, so I hope you understand what I'm saying. So let me go back. Let's go back to the case note again, so that you understand it even further. So, what are the things that needs to be included in the letter? Let's check it out. See, dietitian's monitoring. We talk about the salt intake. Living in a nursing home, obviously, the manager ensures what kind of food the patient consumes. Monitor urine output, fluid intake, pain relief, medication. All these things have to be mentioned in a discharge plan. Discharge plan is always written before the closing. So we call it before closing paragraph, remember. You've not mentioned anything about the medication that is to be continued in future, that is tamoxifen and paracetamol. You need to specify the dosage of these medications. We do not need to be detailed about all the IV things that you've given, but we can just tell in short how we intervened the patient. So you've missed most of the information in the letter. The content severely compromised, organization is compromised in the letter. All right, send other letters, girls. I'll tell you how to write this letter.
Sir,
Yeah,
I already had done this letter, sir, so I have written the another one.
okay. We can talk about it later then. Amrita,
Okay,
send
sir.
the letter. Right, that's it. Okay, anyways, let me tell you how to do the letter. If you don't have any letters, then I'll tell you how to do it.
Sure, I'm sending.
Okay, okay, send quickly. I'm waiting.
Sure,
Yes, I got it.
I did this one yesterday, just for my practice.
What did you say?
I did this one for my practice only.
No, of course,
I
all the
think
letters are for
Mirana
practice.
and mm-hmm, Mirana had already done this.
Just wait a second. Always upload your letters a few minutes before the class so that can be downloaded in.
Mm, okay,
No,
sir.
this is not the letter. This is another letter. There's always a common
Another one.
letter that is always going on in the class. So it keeps following the sequence. If you've done one, the next one automatically comes. So, okay, we'll check on the other letters later. We're going to go towards See, if you are confused about which letter to do, you can always ask on the group which letter is going on, and you'll know it. We'll tell you exactly which letter. Anyways, see here. So this letter is going to be done like this. I am writing to update about your resident. Don't make the mistake of writing patient. Resident, Mrs. Okay, Miss, I forgot, but anyways, Miss, let's write Miss Ellis, who has been treated for, and then write the diagnosis. She would be needing your continuous. Done, finished. In the second paragraph, during the 4 days, or during 4 days, SOSPTLI, hospitalization, Miss Elise received for the, now you can put the symptoms here, the presentation. You know, the intense pain and everything. After being, or after here, you can tell about what? The detail, the stones that we found on which kind of tests, as a new information for the reader, right? So we found stones. What did we find? Okay, let me tell you. What did we find? CT scan showed multiple renal calculi, hydronephrosis, and then we have at PUJ we had 4 millimeter obstructing. A 4 millimeter of stone calculus, right? So we can put it here. So during 4 days of hospitalization, Mrs. received treatment for with various medications. She is currently stable. What made you think that the patient is stable? You can add, what can you add into it? The patient doesn't have hematuria. Now, medical progress. The patient has stable vitals, has stable blood pressure. The respiration is normal. The pain is minimal. And according to the urologist's assessment, the stone is likely to pass in 1 to 2 weeks. So you can write it here, that one, this information. She's currently stable without, currently stable with normal vitals. Yeah, you can put it in the bracket if you want, normal vitals, blood pressure. If you don't want, that's also okay. Then you can talk about as per the urologist's assessment, the stone is likely to pass into this. So she's currently fit for discharge. This is what you tell in the second paragraph. Say that we gave this kind of treatment that has actually made the patient stable at the moment and she's fit to discharge. This is the picture you put. So the combination of your first and second paragraph together, this is called the purpose of the letter. Now after do whatever you want. After that, we have a closing. Yeah, in light of the above, bring in the discharge plan. The letter is finished. So the second paragraph is crucial. This is the most important. Remember. So just arrange the relationship of the first paragraph with the second, and it'll be fine. Okay, so One second. Let me put this speaking, and then we'll do the different letters that we've done. We can check it separately. You know what?
Excuse me, sir.
Yeah.
So in the first part where I had written only the manager, so so we can write the manager or only manager
The
in the
manager,
beginning.
or both are correct, but it's better to write the manager, obviously.
Okay, sir. Thank you, sir.
Both are accepted. Manager, the manager. Both are accepted, of course. The manager is going to be more formal. They're not going to reduce your points from there, don't worry. See, the letters should be well organized. Yeah, so whatever the reader is supposed to do should be given clearly. Whatever things that you need to tell has to be told clearly in the first and second paragraph. After that, whatever comes, just squeeze between the discharge and the intro. I mean, the discharge plan and the intro and the second paragraph. So whatever is left, you can put it in the middle. That's it. The good part was that we did not have to go into the details of uh, the treatment because it's useless from the point of the reader. But if you're writing the same thing to a doctor, for example, a general practitioner, remember your letter is fine, but the discharge plan is still not there. Your letter is fine. If you are writing, wait, let me open my timer.